Which of the following factors is the primary contributor to her systolic heart failure? A 70-year-old woman with a history of ischemic heart disease presents to the emergency department with an acute onset shortness of breath and chest pain. Upon examination, she has an elevated blood pressure, tachycardia, and an S3 gallop. Imaging reveals pulmonary edema. Her left ventricular ejection fraction is found to be 30%. Which of the following factors is primary contributor to her systolic heart failure? Increased afterload, decreased preload, decreased heart rate, impaired myocardial contractility, or impaired myocardial relaxation. Ooh, I'm between the last two. Um, I thought when I see S3, maybe it's wrong for me to do this, but I always assume it's a dilated cardiomyopathy, versus S4, which I would assume is hypertrophic cardiomyopathy. And
Okay.
so ischemic heart disease and acute shortness of breath and chest pain. So probably another, like, maybe not MI, but something similar to an MI. Elevated blood pressure, tachycardia, and S3 gallop. Pulmonary edema, left ventricular ejection rate is going to be 30%. So it's systolic is not working. Um, okay. Impaired relaxation versus myocardial contractility. I would have to go with I don't know, I feel like I'm gonna be wrong. I feel like I would go with impaired myocardial contractility just because I feel like S3 is more of a dilated cardiomyopathy, and so that's not able to contract very well. So I would go with that.
Yeah, you worked through it beautifully. So I think you got the in the realm of kind of the diagnosis here, which is going to be anytime you see ischemic heart disease, you really think about acute myocardial infarction, right? And an infarction just means you block the blood flow to that part of the heart, and it causes that muscle to die, right? AKA, troponins released, all that stuff, right? You get a heart attack, right? And you can tell that it's that because of an acute setting. You get what I'm trying to say?
Hmm.
And so when that muscle dies, it's not going to be able to what? It's not going to be able to contract very well in an
Yeah.
acute setting because obviously it's dead. You know what I'm trying to say? If a muscle's dead, you're no longer able to contract there. Can an MI long term cause impaired myocardial relaxation? 100%. That's way in the future though, because it becomes scar tissue. Does that make sense what I'm saying?
Yeah. Yeah.
So in an acute setting, it's just muscle's dead, right? If the muscle's dead, it doesn't contract very well. And in particular, right, like you said, S3 gallop, right? It just means an enlarged and dilated heart, which that's what it means. And S4 is usually some kind of stiffening where the heart doesn't relax, or a hypertrophy where you're hitting kind of that stiffened wall, right? Which gives you an S4 gallop. But an S3 is usually dilated cardiomyopathy, which can happen in an acute setting for MI because that muscle is not working. So you're filling it, but it's not getting pushed through, right?
Okay.
So
That's
good.
actually really good.